Take it away.
Hi, we're here with Dr. Vivienne Mattelon, an internal medicine doctor, one of the affiliates of American Clerkships, and we absolutely have the pleasure to go ahead and speak with you. And Dr. Mattelon, thank you for coming to our conference here in New Jersey. Kaplan Medical Institute, international medical graduates are here basically wanting to hear from us, and more importantly, hear from attending physicians who will be teaching them in clinical rotations in the future about some of the do's and don'ts when they're applying for residencies. So what will be some pearls that you could give our international medical graduates?
Well, first of all, thank you for having me.
Sure.
And I would tell them first to be very honest, that's number one, to be motivated, but not desperate. And when they are given the opportunity to work in your clerkships, to really make the most effort that they can. Because this is a time to show your abilities on an American level. And this is what a lot of the American residency programs are looking for. They're looking for how you can perform in an American setting.
Interesting. What have been some of the success stories that you've seen? Obviously, you're a success story yourself, being an international medical graduate, but you've definitely reached some incredible levels. What are some other recent success stories that you've seen that you would have said, wow, that's great, that makes me feel good?
Well, I've seen colleagues, former classmates of my own, and they have very successful practices. And in fact, in contrast to even some of their classmates who were American graduates, they have even had more success. So I mean, being a foreign graduate does not have to be a limiting factor. You can just consider it an international factor. I mean, in the sense that it gives you a rich experience. I do not see it as a deficit. I see it as a positive. It is just an enriching aspect to your education.
You actually mentioned success, and I know in your practice you're very, very successful, and you were telling us about some of the medical treatments that you're undertaking. Tell us a little bit about that.
Well, I run a integrative medical center, and formerly I was on staff at 6 hospitals and had mostly a hospital-based practice. At this time, I have internal medicine and integrative practice in the sense that we work a lot with minerals, vitamins, nutritional programs, and I do quite a bit of work with intravenous wellness. So we work with vitamin C and even chelation therapy, and use that as an augmenting type of therapy for patients, even patients with cancer.
You were featured on TV for that as well.
Yeah, we were on CBS News.
Congratulations.
Yeah, thank you.
If you were to, I know we just had a recent clinical trainee rotate with you.
Mm-hmm.
I want you to compare how the first day was and how the 30th day was when they first came in and when they left at the end. How did clinicals make them a better applicant?
Well, I think from a number of ways. First of all, I think the sense of confidence was dramatic. Also, his fluidity in terms of his ability to complete an evaluation was markedly improved. And also his ability to reach decision-making for the patients and to write orders. I think he felt much more confident in that and demonstrated that.
Do you believe that clinicals are an important factor in competing for residency programs for international medical graduates in the United States?
I think the quality of your clinical is extremely important. And it's not just where you did it, but with whom. because you can get a clinical rotation in a hospital setting, but you might be the fifth wheel. And therefore you might just be basically just watching. And what value that did for you is probably minimal. The type of rotations that we are offering and provide for the students, the graduates here, is a little bit different. We want you deep in, hands-on, right in with the patients, so that it is as identical to a type of experience that you would have in a residency. And we also expect you to read. I mean, I expect the graduates, everything that they see that day, I want them to go home and read that night. And then we discuss it the following day. So I mean, it's an educational experience with all the challenges.
Tell me about a typical day for clinical rotation for an international medical graduate with you.
Well, I start at 7 to 7:30 in the morning, and we start seeing patients in the nursing home. We might see between 7 and 10 patients by 9:30. And then by 10 o'clock, we start the office. And we might see between 25 and 40 patients by 7 o'clock.
Wow.
So this is 3 days a week, and then 2 days we have kind of a half day. But they're action-packed days.
I'm sure.
Yes, and we run sometimes as many as 5 to 7 rooms at one time. And then as soon as he's done one room, we talk about it. We make some mutual decisions. I want to hear his decisions first, because I want him to be able to, really give an accounting of what he thinks should be the plan.
Very good, very good. Any suggestions and recommendations you want to give our viewers, our international medical students that are about to become graduates, people that are considering going abroad for medicine, and when they come back, and more importantly, how do they hold on to the residency once they get it, once they do the clinicals and they do great in the medical boards and they get their great letters of recommendation? How do they hold on to it and become a practicing physician in the U.S.?
Well, once they get the residency, I think they just have to be studious. They have to show on a daily basis, from morning report to afternoon rounds, and then the afternoon lecture, and they have to be there, and they have to be there mentally, and then they have to demonstrate that, subjects that are being discussed that they are reading about, because it's expected.
Absolutely.
And it's really not that hard. But it does take effort. So just because you made it into a program doesn't mean you're going to make it out, as you well know.
Absolutely right. So have a
Yeah.
great personality,
Yeah.
study hard, and have great backup.
Yeah.
They should all be able to make it if they put the right effort.
Yeah, and realize that your attending physicians are really those people that want to help and want to teach you. And most of them are doing it out of the goodness of their hearts.
That's true. That's very true. Absolutely.
Yeah.
Absolutely. Well, thank you very much, Dr. Mattelon. You've been great. We're definitely
Thank you.
honored to have you,
It's a
and I'm
pleasure.
honored to have seen you.
Pleasure.
Thank you very much.
Thank you.